The third floor of our building is what we call the garden floor. This is the signature feature of the hospital and something that differentiates our hospital from almost any other hospital that's being built around the world. Part of the reason for this related to the negotiations of going higher within the building. So this third floor really creates this 50-foot garden level that responds to the rest of our campus. The other thing it does is it provides this separation of the public experience from a very open public experience on the first floor to a more private, more introspective public experience on the third floor. One of our board members who was very, very active in our planning process, Ron Johnson, put it this way, and I really like his analogy. He says the first floor is where the public goes in their shoes, and the third floor is where the public goes in their slippers. And we've really tried to create this zone because that's a very, very important separation for patients and their families, that they feel comfortable in the facility. They feel that there's a place where they can go to relax a little bit, get away from the intensity of the hospital environment. So the third floor provides that, not only from its greenery on the roof and its outdoor spaces, but actually from the remarkable views that will be available from this floor as the rooftop from the rest of our campus. So another advantage of being able to go above 50 feet is we see the entire valley from this third floor public space. The space is organized around our courtyard, center courtyard, and our dome. The dome is at this third level, and that circulation around the courtyard and dome space organizes these outdoor spaces on the third floor. The first of those spaces faces our courtyard entrance, and it's a dining facility. It's similar to a dining facility we have in the current hospital that provides an area where patients and families can dine in a much more relaxed environment than our main cafeteria space on the first floor. But it also provides a conferencing center for our staff for morning conferences and conferences late in the day. The remarkable feature about this space is it has the view back to our existing campus, our entry area, and our fountains. So it will definitely be a space where people who are there will know where they are, will understand the Stanford experience, and be able to be oriented to the entire medical campus from that dining area. We go to the next quadrant, and the pavilion or building within that garden quadrant is what we call our Family Resource Pavilion. This pavilion has areas for our chaplaincy services, library functions, family resource areas, and waiting areas for families who are here for long periods of time or overnight. So it is totally at the service of our patients and families, and it is the nicest view out to the Santa Cruz Mountains from the campus. So we put this area as the most prominent of our pavilions. We come to the next pavilion area, or rooftop, which is on axis with our entry, and this is our garden space. It is totally designed for an outdoor experience, but heavily programmed for our patients and families. So we have areas where patients can plug in to utilize electronic devices. Patients on oxygen can be out in the outdoor space. So really bringing the outdoor environment into the hospital setting at this floor. We also have a series of pathways for patients and families to walk outside and to actually gauge the distance of how far they can walk during their rehabilitation here at the hospital. The fourth of our quadrants is a pavilion that's for our staff. It's primarily for our staff that are going to be working on the interventional platform, and that platform runs 24/7. A lot of these staff, frankly, don't know what time of day it is. So the ability to have their lounge and locker room space on a floor where they see natural daylight and have access to outdoor space is key to keeping these people working in this very, very highly intensive area sane. It's one of the first places where we've seen this kind of environment for our staff really put as a focus of the people who work here and their daily activities. On the third floor of the parking structure, we continue our garden environment with 2 pavilions. One of the pavilions is our conferencing center, which will service not only our staff, but will serve the community. So for meetings that are any time of the day or night, there's parking underneath this pavilion in the garage. People can come up and access this community pavilion without having to go through the entire hospital for access. The secondary pavilion there has administrative functions for the hospital, again with a roof-like environment and easy access for these people not having to be embedded in the main hospital building itself. So we're very, very excited about having this outdoor space and basically bringing the quality of the campus environment here at Stanford up to the roof and accessible to patients.